Hello, I'm Dr. Nityanand Das. I'm Diabetes Reversal Consultant. The topic of my today's discussion is your diabetes treatment correct? In fact, is your type 2 diabetes treatment correct? So, I'm sure this is going to be quite surprising for many of the people. So, my this today's lecture is directed towards education of the type 2 diabetes mellitus patients, the general public, as well as the doctors, endocrinologists, and physicians who treat type 2 diabetes by the conventional method. This today's lecture is directed towards educational purposes to all these people. This today's lecture is not an individual medical advice. For individual medical advice and individual medical treatment, a patient has to consult their doctor. So this video is purely for educational purposes and to make aware the general public as well as the physicians and doctors about the truth about type 2 diabetes mellitus treatment. So in this lecture today, first of all, I'll tell you about what is the cause of type 2 diabetes. Then I'll tell you about what is the conventional treatment of type 2 diabetes. And then I'll tell you about the different medicines for the treatment of type 2 diabetes conventionally. And while describing about the medicines, I will also I'll give you the comparison whether technically the current conventional treatment is appropriate or not appropriate. And I'm sure after listening to whatever I'm telling you, whatever information I'll be giving you, I'm sure most of the wise people will be able to understand themselves whether the current conventional treatment is correct or not correct. Okay, so let's begin. So what is the cause of type 2 diabetes mellitus? So the type 2 diabetes mellitus is a multifactorial disease. That means there are multiple causes. Many of them are known, many of them are still not clearly understood. But all these factors, whether it is genetic, environmental, drugs, toxins, whatever it may be, all these factors ultimately cause two pathology. And because of these two pathologies, the patient develops type 2 diabetes. So what are these two pathologies? One is the glucose intolerance. The patient develops intolerance to carbohydrate, not glucose, I should say carbohydrate intolerance. The patient develops intolerance to carbohydrate. And another pathology is insulin resistance. The patient develops insulin resistance. So these are the two basic pathologies which ultimately lead to development of type 2 diabetes. Before I proceed further, let me explain you what is carbohydrate intolerance. So in general, in a normal person, if he eats carbohydrate, whatever amount of carbohydrate he may eat, the body is able to metabolize that. That means, in simple words, the body is able to digest that, and his blood sugar level does not rise; it remains under the normal level. But in diabetes, type 2 diabetes patients, there is intolerance to carbohydrate. When the patient eats carbohydrate, the body is not able to metabolize that, and hence his blood sugar level increases after ingestion of carbohydrate. So he has an intolerance to that. He cannot tolerate carbohydrate load. Then another pathology I told you is the insulin resistance. Then what is this? Insulin resistance means whatever insulin is there inside the body is not able to use that insulin effectively. This is known as insulin resistance. So why does insulin resistance develop? Insulin resistance, again, there are multiple causes. There are two important causes. That one is the defective function of the insulin receptor, which are present on the surface of the cell, and second, excessive amount of insulin. So let me give you one more information. Majority of the type 2 diabetes mellitus patients have very high insulin level inside the body. Okay, and this high insulin level is one of the important cause of causing this insulin resistance. So this high insulin level leads to insulin resistance along with other factors. So please remember this: the most of the type 2 diabetes mellitus patients have very high insulin level inside the body. Please remember this, because I will again come back to it later when I describe about it. So please remember these two pathologies. The body is not able to tolerate ingested carbohydrate, and there is high level of insulin inside the body, and there is insulin resistance. Okay. So this was regarding the cause of the type 2 diabetes. Now, uh, what is the conventional treatment of type 2 diabetes? Conventional treatment is the treatment which is prescribed currently by the doctors all over the world for the treatment of type 2 diabetes. So this is known as current conventional treatment. So I'll use this word conventional treatment many times. So please remember that it is the treatment which is prescribed by doctors all over the world. So what is the current conventional treatment? In the current conventional treatment of type 2 diabetes, two advice is given. One is the dietary and lifestyle advice, another is the medicine advice, drug advice. In the diet and lifestyle advice, two things are said. That the physicians or the doctors treating diabetes, as well as the dietitians who treat the who give dietary advice to the diabetic patients. The doctors and dietitians both will tell you in many times that eat frequent meals, so frequent small meals. So they will tell you that eat 3 major meals and 3 minor meals. That means they tell you to eat 6 times. Okay, this is the current conventional dietary advice. So please remember this. They are telling to eat you 6 times a day. I will again come back to it when I describe about the rationale behind this later on. And then another dietary advice is that your dietitian or doctor will tell you to eat 50 to 60% carbohydrate in the food. Whatever food you eat, they will tell you to eat 50 to 60% carbohydrate, approximately 55% carbohydrate, then 20 to 25% protein, and 20 to 25% fat. Okay, this is the dietary advice given conventionally. So please remember again this. The current conventional advice is to eat 50 to 60% carbohydrate. That means most of the food item, majority of the energy is to be taken in the form of carbohydrate as per the current conventional dietary advice. Please remember this. I will again come back to it later on. Okay. So eat frequent meals and eat 50 to 60% carbohydrate. This is the current conventional dietary advice. Then another in lifestyle changes, they say do some kind of exercise, etc. Okay, now another advice in the current conventional treatment is the medicines. So the medicines for type 2 diabetes mellitus are divided into 7-8 categories. Okay, 7-8 groups. There is one group of drug which consists of metformin. This drug acts a little bit on the insulin resistance. I told you that type 2 diabetes patients have insulin resistance. So these drugs act a little bit on the insulin resistance. Okay, but not very strong drug, does not affect much, only a little bit. So not very useful for decreasing the insulin resistance. Another group of drug is there's pioglitazone. Okay, thiazolidinediones. In this, the drug is pioglitazone. Pioglitazone also acts a little bit and helps in reducing the insulin resistance, only a little bit, not a very potent drug to insulin resistance, so not much useful in decreasing the insulin resistance. However, it acts a little bit on that. Okay, so and there is one more group of drug called SGLT2 inhibitor. I will talk about this later on. But let me tell you, besides this 2 group plus SGLT2 inhibitor, besides these 3 groups of drugs, all the other groups of drugs act directly or indirectly by increasing the level of the insulin inside your body. So these drugs force the pancreas. Pancreas is the organ which produces insulin inside your body. Okay, so all these groups of drugs, 5 groups of drugs, all of them directly or indirectly force the pancreas to produce more insulin. They increase the level of the insulin and thereby they reduce the blood sugar level. So if you remember, I have told you that the type 2 diabetes patients already have high level of insulin inside the body. Okay, they have insulin resistance and the insulin level inside the body is very high. And this high insulin is a cause of various problems. And I have also already told you that high insulin level is one of the major cause of insulin resistance, and insulin resistance leads to development of the type 2 diabetes. Just now try to understand. Your body already has excessive amount of insulin, and because of that excessive amount, your body has developed insulin resistance, and your doctor has given you medicines which will further increase the level of the insulin inside the body. Now you decide whether it is technically logical and technically appropriate treatment or not. So, and one more thing, one more technical logic you have to understand. that by the time your diabetes is diagnosed, so suppose your diabetes, type 2 diabetes is diagnosed today, that doesn't mean that you have developed diabetes today. Okay, that means that your body had this disease at least 10 years before the diagnosis. Okay, and what was your pancreas doing? I told you pancreas is the organ which produces insulin. And insulin is the hormone down the blood sugar level. Okay, insulin is the hormone which brings down the blood sugar level. So, by the time your diabetes is diagnosed, your pancreas, which produces insulin, has already tried its best to increase the uh, level of the insulin so that your blood sugar level, whenever it rises, is brought back to the normal level. But now see this: when your blood sugar level rises, try to understand what your pancreas does. It produces some insulin, and your blood sugar level comes to normal range. Then, if pancreas is not, if blood sugar level does not come down to the normal level, then the pancreas produces more insulin, so that the blood sugar level is brought down to the normal level. If again the blood sugar level is not doesn't come to the normal level, the pancreas will produce more insulin. Okay, so in order to keep your blood sugar level in the normal range, your pancreas tries to produce more and more insulin. But what happens? Everything has a limit, has a capacity. So your pancreas also, by producing more and more insulin to keep your blood sugar level under normal range, it becomes exhausted ultimately. I told you, this disease is present at least for 10 years at the time of your diagnosis. So over the last 10 years, or even maybe more than that, your pancreas was trying to work harder and harder, produce more and more insulin to keep your blood sugar level under normal range. And when your blood sugar level starts rising, that means your pancreas is so much exhausted, so much, it has become so much weak that it fails to produce more insulin than what is required to bring back the blood sugar level to the normal range. So your pancreas has become exhausted, and almost 50% of the function of the pancreas is lost at the time of your diagnosis. So if you're diagnosed today, that means if you're diagnosed with a type 2 diabetes, if your blood sugar level has is more today, so that means your pancreas is so much exhausted, and it's not able to produce more insulin, and almost 50% of the function of the pancreas is lost. So now see this: now these drugs increase the level of the insulin inside the body, and they force your already exhausted and tired pancreas to produce more insulin. Now just see this: a pancreas, an organ which is already tired, exhausted, it needs rest, and these drugs are forcing them to work more. Now, I'll give you one analogy. It is something like flogging a tired horse. What will happen if you flog a tired horse? It will start running for some time, but ultimately it will fall down and collapse. The same thing happens with the pancreas. So instead of you improving your disease, these drugs ultimately, by forcing the tired and exhausted pancreas to work more and more, ultimately cause failure of pancreas in the long run. Okay? So your doctor has given you this drug in the good faith that it will improve you, but ultimately what is going to do? It will worsen your disease. It will worsen. It will further exhaust your pancreas, and your pancreas, which was working at its maximum, it will start to fail, and it will and it will stop producing even the amount of insulin which it was producing now. Okay, so there are two fallacies in treatment by all these groups of drugs which increase the insulin level. So they are forcing already a tired organ, they are flogging a tired horse, and the insulin level, which is already very high in the body, they are increasing the insulin level further. These are the two fallacies with all these groups of drugs which act by increasing the insulin level in the body. Now you yourself can decide whether it is appropriate treatment or not appropriate treatment. Now there is another group of drugs which is called alpha glucosidase inhibitor. There are 2-3 drugs in this group. What these drugs do? How do they act? They inhibit the absorption of the carbohydrate in your intestine. Okay, whenever you eat carbohydrate, and if you eat these drugs, they will inhibit the absorption of the carbohydrate. It will slow down the absorption of the carbohydrate. Okay, now see this. See another fallacy. Your doctor has told you to eat majority of the food as carbohydrate, 50 to 60% carbohydrate. Then he is giving you a medicine which reduces the absorption of the carbohydrate. Just see what is the sense in this. You are being advised to eat carbohydrate, then you are being given a medicine which reduces the absorption of the carbohydrate. So the philosophy is that if you have to reduce the absorption of the carbohydrate, then why are you telling the patient? Why are you telling the patient to eat more carbohydrate? So this is another fallacy. Give carbohydrate, then give medicine to inhibit the absorption of the carbohydrate. Okay. Now another group of drug which I told you, SGLT2 inhibitor. SGLT2 inhibitors do not increase the insulin level inside the body. So in this way, these are much better than all those groups of drugs which increase the level of the insulin inside the body. They are much better. This SGLT2 inhibitor, by the mechanism of action, is much better than those drugs. But there is a fallacy with this drug also. So this drug acts by removing excessive carbohydrate in your blood via urine. So this increase the excretion of carbohydrate through urine. Okay. So now I'll give you one analogy. Suppose if there is a water tap which is open and there is a bucket is placed below that water tap. Now what will happen? So water will fill in that tap for some time. Then when the bucket is full, it will spill over the floor. So if you want to keep your floor dry, what can you do? You can mop it. So if the water has spilled over the floor, you mop it. The floor will become dry. But after some time, the water will again spill over the floor. You again mop it. Again it will become dry. Then again water will keep flowing because the tap is open. The water will keep flowing on the floor, keep spilling on the floor, and you keep mopping. The SGLT2 inhibitors work like this. You keep on eating carbohydrate, the blood sugar level will increase. Then you force out the blood sugar level through urine. Okay, again you eat a carbohydrate, blood sugar level increase. Then you force the carbohydrate, remove the carbohydrate through urine. Keep on removing through urine and keep on eating. So this is the fallacy. Although it can reduce your blood sugar level by forcing out carbohydrate through urine, and it is much better than those drugs which increase the level of insulin. But again, in the long run, it is not going to solve the purpose. Okay, because the carbohydrate is coming in, you are throwing it out, coming in, you are throwing it out. So it doesn't solve the purpose in the long run. So what should you do? In my analogy, instead of mopping the floor, what should you do? You should close the tap. So you should address the root cause. The water is coming from the tap. You close the tap. Then only your floor will become dry permanently for a longer time. Okay. Now all other groups of drugs, as I already told you, whether it is insulin, whether the GLP receptor agonist, whether it is sulfonylureas, meglitinides, DPP4 inhibitors, all these groups of drugs directly or indirectly increase the level of the insulin inside the body. And I've already told you what happens because of this. Even the insulin injection, insulin itself increases the level of the insulin inside the body. Okay, so technically speaking, I have told you the technical rationale, technical logic behind it. So most of these drugs, all these drugs are not technically, none of these drugs technically act on the root cause of the disease. I have already told you what is the root cause. The root cause is the carbohydrate intolerance and the insulin resistance. So none of these drugs act on these two factors. So that's why, in spite of eating the conventional medicines, the disease, unfortunately, this is the fact for all the type 2 diabetes mellitus patients, in spite of the treatment with medicines, the disease continues to progress. In spite of eating medicines, the disease continues to progress and it gets worse and worse time. Even if your blood sugar level is within normal range by eating medicine, your disease will continue to progress because this root cause of the disease is not addressed. Okay. So now you must have understood whether your treatment with medicine is correct or not. I hope you will be in a position to decide it yourself. Now let's come back again to the dietary conventional advice. Dietary conventional advice told you to eat frequent meals. Eat 6 times, 3 major and 3 minor meals. So what happens whenever you eat something, your blood sugar level will increase. Okay. And to decrease the blood sugar level, your pancreas will produce more insulin. Your insulin level will also increase, and the increased insulin level bring back your blood sugar level to normal range. So once the insulin level is increased, it takes about 4 to 6 hours to come down to the normal level. But if you eat 6 times a day, then before the insulin level has come down to the normal level, you will eat again. Okay, so again your insulin level will rise again, and then again before it comes down to normal level, again you will eat. So whenever you eat, your insulin level will increase, and by frequent eating, you will keep your insulin level, permanently high inside your body. And I already told you in the beginning of this discussion that high insulin level is one of the cause of the insulin resistance. So by eating frequently, you are increasing your insulin resistance and you are making your disease worse. So this advice of eating 6 times a day, now you decide yourself whether it is appropriate, technically logical or not logical. So now regarding the carbohydrate composition of the diet, your doctor and your dietitian has told you to eat 50 to 60% carbohydrate in your diet. So now just see, try to understand. I have already told you the type 2 diabetes mellitus patients have carbohydrate intolerance. That means their body is not able to tolerate carbohydrate. And in spite of body not able to tolerate, not able to metabolize carbohydrate, not able to digest carbohydrate, your advisors are telling you to eat 50 to 60% carbohydrate. Just see, is it technically logical? You decide yourself. So what should actually be done? I will give you one analogy. If you have allergy to something, what will you do? You will keep away from something. Okay. If you are allergic to egg, you will not eat egg. So similarly, since you are intolerant to carbohydrate, the patients should be advised to decrease the consumption of carbohydrate or not to eat carbohydrate. Okay. So please remember that scientifically eating external carbohydrate is not required by the body. Whatever carbohydrate is needed, the body can produce on its own inside the body. You don't have to eat it externally. So in spite of telling you that the appropriate advice should be to decrease the consumption of carbohydrate, but you get the advice to eat 50 to 60% carbohydrate. Okay, so this is the fallacies. These are the fallacies of dietary advice. Then I have told you about the fallacies of the medicine advice. So now, if this is not to be done, if this advice is not to be followed, then what advice to follow, and what is the correct treatment of, what should be the technically appropriate treatment of type 2 diabetes? Okay, so my dear patients and friends, the correct treatment of the technically appropriate treatment of type 2 diabetes should be the treatment which will address the root cause of the disease which is the carbohydrate intolerance and the insulin resistance. So since we cannot remove the carbohydrate intolerance, we cannot correct the carbohydrate intolerance permanently inside the body. So we have to reduce the consumption of the carbohydrate. So the patients of the type 2 diabetes mellitus should be advised to reduce the consumption of the carbohydrate because the body is not able to tolerate it. Then how much carbohydrate to eat, how much reduction is to be done? So my dear patients and friends, one size does not fit all. So how much carbohydrate should be eaten and how much restriction should be done will depend upon patient to patient, will vary upon the patient to patient. Suppose if the disease is very severe, in an advanced stage, then severe carbohydrate restriction may be required. If the disease is in early stage, only little bit carbohydrate restriction may be sufficient for that patient. So that has to be decided on the individual basis. Now, how to reduce the insulin resistance? So my dear patients, friends, there is no drug which will effectively reduce your insulin resistance. The most important, the most effective treatment for insulin resistance is the less frequent eating. This is also called time restricted eating or intermittent fasting. So I've told you, whenever you eat, your insulin level will increase inside the body. So you have to decrease the frequency of the eating, and by decreasing the frequency of the eating, your level of the insulin will not rise frequently. So it will come down to a relatively lower level, and this will reduce your insulin when your insulin resistance. And when your insulin resistance will reduce, then whatever insulin is there inside the body will be able to act properly, act in a better way inside the body, and your blood sugar level will come down more effectively. So you have to eat less. How many times to eat? How much? What should be the frequency? What should be the protocol of the time restricted eating? Will again, one size does not fit all. It will depend upon the case to case basis. Will vary from patient to patient. But time restricted eating is, or popularly also known as intermittent fasting, it is a very useful strategy to reduce blood sugar level. And there are different variations of the intermittent fasting and time restricted eating. Some of them are very useful, some of them may not be useful, but the useful variations are definitely one of the best way to reduce insulin resistance. So my dear friends, this is the technical logic to understand whether the current conventional treatment is right or wrong, and what should be correct treatment. One of the way of more appropriate treatment is the eating low carbohydrate diet, and American Diabetic Association releases its guidelines and recommendation for management of the diabetes every year. And this current 2023 edition, even the American Diabetic Association has mentioned in its recommendation book that eating low carbohydrate diet has the most evidence for reducing blood sugar level, and it is the most researched, and it is an effective way of reducing blood sugar level. So it is a scientifically researched. There are plenty of scientific evidence of this low carbohydrate diet. Whenever you eat low carbohydrate, then you have to eat a relatively high natural fat diet. So it is a low carbohydrate, high natural fat diet. Regarding fat, there are so many misconceptions that eating this fat is bad, that fat is bad, ghee butter is bad, but it is not like that. Okay, so there are so many misconceptions. Whenever the patients come to us, then we discussed everything with the patients. And low carbohydrate, high natural fat diet is one of the way of treating this, controlling the type 2 diabetes without medicines, along with time restricted eating or intermittent fasting. And my purpose of this lecture was to make you understand and make all the doctors and physicians treating this type 2 diabetes mellitus patient, the purpose was to make them understand what they are doing and what is its ultimate effect. So today what happens, most of the doctors treat the doctor as per the recommendations. And there are so many conflict of interest, there are so many problems with these recommending authorities also. So instead of, I urge all the doctors treating type 2 diabetes to not to follow the recommendations of recommending authorities blindly. Don't follow the recommendations blindly. Try to apply your technical knowledge and try to see whether that recommendation is appropriate, whether that recommendation is beneficial for the patient or not. I've already told you, I've already described what we are doing with the drug and what this drug ultimately do with the patient, and whether it is technically appropriate for the patient or not. So please, my request to all the doctors not to follow the recommendations blindly, to apply your scientific and technical knowledge and try to decide yourself whether whatever you're doing with the patient is appropriate in the long run or not. And I hope the type 2 diabetes patients, the general public, as well as the physicians have learned something from this lecture, and it will be useful for the type 2 diabetes mellitus patients. So this is Dr. Nityanand Das signing off. Thank you very much.